you for the sponsor and for the committee of this conference who invited me become a speaker in this conference. So like Ms. Ghazal said before, so I made this research. It starts from my background. So when I practice and I already graduate and I practice in my clinic and hospital, I see a lot of kids have the same problem with me, but the cause of the problem is totally different with me. But the similar problem is the same, so almost the same. So that's why I just curious and I try to find the method who can help the kids, and also this method I use for myself first before I use for my all my patient. Okay, so I will start about my presentation.
Yes.
Yes. Yeah. So I will talk about the effectiveness nerve activation for language ability and concentration on children. In Indonesia, during from 2000, so we have digital booming. It's like handphone, laptop, tablet, Nintendo, game online, and everything. So this is so booming, and every kids, they already know about this. They are a baby, I think. So, and the parents so busy and not aware about their kids' development, and because the parents so busy, so the parents just give their babies baby movie all the time, or play the handphone, the game on the laptop, and it will be about 6 until 8 hours a day for the baby use the handphone or watch the movie. So what happened with this area, with this attitude for the parents, it's become built a problems. In my research, since 2006 until 2009, so this is already 20%, 80% children have issue and language and concentration. They always got the issue in speech delay and ADHD also. So after the kids have the problems with the issue, the parents got panic and try to find the solution. Many of them cannot find the solution, and until their kids already 5 years old, the kids still cannot have the communication improve, and also they cannot be focused and cannot respond when they call when the parents call their name. So that's why a lot of parents come to see me, because a lot of my patients, a lot of the parents know about my background history. And then I think I learned psychology, and I know before that my eye cannot synchronize each other. So that's why I want to make better about my eye, my concentration also, and I try to find the method. So this is, I find the nerve activation. This is a very simple motion and light message in the head, body, and mouth. So I use it for my first, for myself, and then I to connect and learn about the nerve in the mouth and everything. So I use it for my patient and have a lot of improvement. So that's why some doctor from my hospital push me try to make the research, make it simple and easy to understand, so the parents can be follow about the presentation. And okay, and then as we know, concentration we have for the elementary school, it's only 15 or until 20 minutes for kids to be full concentrate. And for junior high school until senior high school, it's around 45 and 60 minutes to full concentrate. And for us or young adult who already working and everything, they usually have 2 hours only for full concentration. That's why at school or in the office usually have the break, because to give the time to eye relax and the brain relax also. My nerve activation is the combine between neuropsychology, child psychology, speech pathologies, acupressure, and then kinesiology. So I split about the nerve activation for 2 parts, the head and the part of the mouth. Then how the method for nerve activation? So this is so simple. This is about the massage. I have a gymnastic movement, activation of facial muscle, and activation in the mouth. So some of the patients, when they come to me, I will give the massage and activate about the facial muscle and in the mouth. And then I will give the homework about gymnastic movement for the parents to do at home for the kids. It's very simple, so the parents can follow it and have improvement for the kids. The process is very simple because I know a lot of parents so busy, already busy, and sometimes they got lazy to help their kids. And they usually in Indonesia have the nanny or a babysitter or maybe others to help them to take care of their kids. So that's why I give the homework for gymnastics each day only 15 minutes. It's very simple. It's like a cross core or lateral movement or for the eye, for the focus, and then for connected between brain, the left and the right brain. So each day 15 minutes at home, and then once a week they come to me around 30 until 45 minutes a week I activated about the head, the mouth, the facial also, and then teach them to do the movement at home. And sometimes I got a lot of patients from the other town. So they come to Jakarta, where I living right now. So because they are from other city, so it's not easy for them to come every week. So that's why I make it simple for my patient from the other Jakarta. I give them every day, done in 5 days in the row. So they come just weeks in Jakarta, and they will come back to their city, and then they will come again next month for repeat all the activation. And then okay, and then I can see this research about my patient, around 200 patients. who have age between 3 to 5 years old. So I use the once a week for 4 months, and I can see, and all the parents can see, the children who still cannot speaking and talk and no sound, and there is no sound, and then in 4 weeks they can say and call their parents, their brother and sisters, and also if we can ask them, they can answer directly but only in one word, but they already have two-way communication. And also for the patient who are from other city, in they come once a month, and then once days on the road, they got increase 80% also in communication and focus. And this is why a lot of patient and doctor also they got surprised because it's so simple, simple movement, but it can be work to help their kids. I don't have the picture because I don't have the picture of the brain because before my PowerPoint is broken, so I make a new one right now after I finish my patient. But in the original my presentation material, they have a brain picture that the first before the kids never got the activation, the brain it's like separate and have like a line between right and left, front and back. And then after they got nerve activation completely after 4 months or in 6 months later, they take another MRI, so we can see about the brain already become integrated, and there is no line, there is no more line and separate between the right, left, and forebrain and brain. So that's my conclusion, that nerve activation increase communication and focus. This is so simple presentation that I make because I'm not similar with the scientific language for the brain and everything, because usually I become a speakers for the parents, so I need to make so simple so parents can be understand what happened with their children and know how to help their kids. So that's all my presentation. Thank you for listening.
Thank you so much, Dr. Erna.
Yes.
Thank you for being here. Thank you for presenting here.
Yeah.
Even I would like to mention, I would like to add on that how you and your